Welcome back to the Holistic Health Bites podcast. Today, we're going to have an interesting conversation that we haven't had on this show before. We're going to talk a little bit more about how to handle kiddos. And I am welcomed by a special guest, Dr. Joel Warsh, also known as Dr. Gator. Welcome.
Thanks for having me on. I'm excited to chat.
Yeah, absolutely. So, will you just kind of do a brief introduction to everybody and tell everyone a little bit about your specialty?
Sure. So I'm an integrative pediatrician. I did all the regular pediatric training, trained at a great allopathic Western medicine program, but just got a little bit frustrated with the regular system, super short visits, medications for everything. And so that's what really led me to start learning about integrative medicine and natural medicine. I talk about this often. I'm not against Western medicine at all. I just think that there's a time and a place, and we're far too fast to jump to modern medicine these days. And there are a lot of natural practices and ancient practices out there that have been used for generations that we can use when it's appropriate. Sometimes you need a medicine and that's fine, but there are a lot of other opportunities out there. And so I try to blend the best of both worlds together for that. And I really have been pretty excited over the years to see how people have taken to that. I really didn't know, that there would be so much interest in it. I feel like it's growing really rapidly. And I've seen that on social media, which obviously you don't get any training as a doctor in social media, but I've seen that, grow really fast. And now I'm starting or wrote my own book that's coming out soon on parenting and integrative parenting and just all the things to try to help parents de-stress and, blend a little bit of those first 3 years in terms of integrative medicine and just, the regular questions that parents have. So I'm kind of on the integrative parenting journey.
Oh, that's so good. And I agree with you that it seems like by the day we're seeing more and more functional and integrative and holistic and, all of these supportive practices getting out there. So people, I think, are becoming more familiar with these practices and understanding how it's different. It doesn't replace conventional medicine. We're always going to need surgeries and procedures and pharmaceuticals and those things, but there's this whole other avenue that we can go down. And I love that you focus on parenting and kids because I don't think there's as much in that realm yet. And I think this is an important topic to delve into. So I'm glad you're here today so you can tell everybody more about what that looks like. So tell us a little bit about your practice. What are some of the things that you incorporate into your practice that might be different than what they would see with their traditional pediatrician?
So with a traditional pediatrician, I mean, if you think about it, you're going to the office, you're doing your checkups, you're doing your weight, your height, all those things, but you're mostly going there to focus on treatment. So I think that's where modern medicine is very good, but it's where the focus is, you have problem A and you get treatment B. So you have a rash, here's the steroid cream. You have a cough, here's the antibiotic. And where integrative medicine comes in is that one, we try to focus more on prevention if we can, because I think that we're pretty good in medicine at treating diseases, but we're not very good at preventing it. Chronic disease is going up, up and up and up, and we're certainly seeing that in adults, but it's also, creeping into kids to the point now where like 1 out of 2 kids have a chronic disease. And so modern medicine just isn't spending the time or really thinking through enough in terms of prevention. And then also just when something does come up with treatment or support, how can we support the body in its natural how to support the immune system naturally as opposed to just treating something. So you may, as I said, you might need an antibiotic for something, but a lot of times you don't. So maybe there are other things you could use, like elderberry syrup or vitamin D or zinc or vitamin C that we can use instead or as a bridge or also with a medication to help support your body a little better.
Yeah, I love that. And I think there's so much that we just, as citizens, don't necessarily know that there's all of these amazing things that were used long before medications were created that kept people healthy, that either prevented them from getting sick or helped them recover once they were sick. And I think, like you mentioned, we need to go back to some of these ancient remedies that have been used for centuries with lots of different cultures and stuff. So I think there's a lot of different approaches. So what would you say to the parent out there who's like, yeah, I really don't want to rely on all the medications, but I just don't even know where to turn. Obviously they can turn to an expert like you are. What are some other things that they can just start doing today to help their kids be healthier?
I think the biggest thing is to first make that decision that you want your family to be healthier, that you understand that there is such a huge risk for chronic disease in kids, like 1 out of 2. So that's pretty big. That means you have 2 kids, one's going to have a chronic disease like asthma, allergies, autoimmune conditions, autism, whatever it may be. So once you realize that, then you can make a decision. Okay, I want something different. I don't want that for my family. Or my kids already do have some sort of chronic condition, and I want to see if I can cure it. I want to see if I can make it better. I want to see if I can support them more. Are there other things that we can be doing? So once you make that decision, then you can just start learning about, anything that is involved in health. So diet, sleep, exercise, stress reduction. I mean, simple things that you can do at home right now are just being mindful of things that you purchase. If you're mindful of every single thing that you buy, if you read the labels on all the food that you purchase, if you are thinking about chemicals and trying to reduce those as much as possible, that's going to get you a really long way. I mean, just simply turning over the label when you're buying a food and saying, "Oh, I don't even know what that word is." You don't have to know every single thing. You don't have to be a chemist. But if you don't know what the long chemically name is, it's probably not good for you. So go buy the thing with real words.
Yeah, or buy the thing that doesn't even have a nutrition label because it's only one ingredient.
Even better, yeah.
So, what are some maybe common mistakes that you see when the parents that come in with their kids? What are some things that they're doing that maybe they think are actually the right things to do, or they just don't know? And what are some things that they can be, doing instead?
So, in going back to the last example, I think one of the big mistakes that we see is parents thinking that their kids are eating healthy or thinking that they're purchasing healthy, as opposed to actually reading the labels and everything. Then not just with food, but even with products. I mean, sometimes we don't think about it. Even you go to the doctor and it's like, oh, just put that cream on, or oh, just use Vaseline or whatever, and you don't look at the ingredients and you just put on the chemically whatever on your kid's skin and you forget it's an organ and that's going into their body. And it's not to have doom and gloom that like, oh, if you put one cream on, it's going to cause some sort of autoimmune condition in the long run. But what we're seeing is what we're doing is not working and it's a buildup. And if we're not conscious of all the little things that we're doing, we're surrounded by so many chemicals we have no control over in the air that we breathe, in our water, in the food, even at the best of food that we get. So if we can be mindful of every single decision, then that can get you a long way. So I think it's just again going back to being mindful and making health conscious choices. So I think that's a big one. Number two, I think not taking into account mental health. We have such a mental health epidemic these days, even in kids. And I think just being mindful again of that is something that's really important because kids are more stressed than ever. They have more anxiety than ever. Like 7 to 10% of kids have a mental health conditions. 7% have an anxiety disorder. The numbers are staggering. And so we need to be thinking as parents, well, what can we do that is simple to help those kids to de-stress a little bit, to get their mind off of things. We need to be off of social media, to watch the news a little bit less. All of those simple tools that we do have, if we can, reduce their stress just a little bit, then that can go a long way sometimes.
Yeah, I think that's such an important point, and I don't think it's talked about enough. I agree with you that I think in adults and kids, this mental health crisis is really a problem, and it's very much driven by the toxins and the poor food and the high stress loads and just all the things, poor sleep, not enough sleep, the wrong nutrients. Even when you're trying to do your best, it can be really hard. And of course, then you try to hyper focus on it and you just add stress to the whole situation. So I definitely think that's a major thing that we all need to pay attention to. And even in kids, I think a lot of people don't realize how much kids are taking on the stresses of the world today. And we do need to focus on that.
Can I just say also, one of the things and one of the reasons why I wanted to write the book and even start the book talking before me as a pediatrician, because medicine's so fractured, right? It's like, oh, we're a pediatrician, we're taking care of kids. Oh, cardiologist, they're taking care of the heart. But it's the whole person. Every part matters, and your kid's health matters even before, they're born. And what's going on in utero matters. What you're doing as a parent right now, even if you're not pregnant, all these things matter for our kids' health. And that's how I kind of start the book and talking about wellness and how important our own health is because I think when you read a lot of parenting books it really focuses on the kid, which is important. Obviously we discuss all of those issues, but you won't have a healthy child if the whole family isn't healthy. And I don't think many parenting books, none that I know, really go through kind of both of those things, the main parenting questions but also the health aspect, because most parenting books are written by a psychologist, a mom, people in that world. It's not a lot of pediatricians that have wrote parenting books. So yes, we can dive into some of the parenting questions like potty training or tantrums or what happens in the hospital, but you get a little bit of a different aspect because what's missing from those books is they don't have the medical side of things, which I think is extremely important and is all intertwined. And all the stuff that they're talking about is fantastic and amazing, but it doesn't include how do I keep my kid healthy? What do I need to do? And I think that's really important, especially now with the chronic disease epidemic that we have. Um, there's very little that's more important than how do we keep our kids from getting sick and how do we keep them from getting a chronic disease.
Yeah, and so many of the products made to give your kids or put on your kids or use with your kids are the problem. So
Hmm.
many of them are loaded with toxins and chemicals and estrogen mimickers and other endocrine disruptors and terrible chemicals and synthetic vitamins and just so many bad things that it's like the things that you're actually being sold are part of the problem. And so
Hmm.
I do think we need a much bigger focus on the medical health side of things, not just the behavioral, psychological, and kind of mom trick sort of things. I think that's a good way to incorporate that into the book. So I'd love to hear more about what else is in the book, who really should get the book when it comes out in a couple of months, who should pre-order it now, all the things about the book.
Thanks. Yeah. Well, first of all, again, it's called Parenting at Your Child's Pace, the Integrative Pediatrician's Guide to the First 3 Years. So it's for new parents, especially if you're pregnant or you have a young child, then that's where the book is tailored to. And something that you mentioned that I thought would be interesting to talk about here would be you were talking about like, the tricks or the things that people are saying to get healthy. And so in the first chapter, in the introduction, I talk about the Dr. Gator smoothie. And it's, the Dr. Gator smoothie for your health. And the reason why I talk about that is because if you look at any of the other, well, not any, but a lot of the books out there from the gurus, and I'm, air quoting, can't see this, then they always have their smoothie, right? It's like, oh, if you just drink this celery and have these, carrots and put these things together, it's going to cure all things, going to cure your cancer, magical, this is for everything. But the reality is there's no such thing. And anybody that says that, they're really there's no truth to it. I mean, certainly some things can help you with your health if you're eating healthier, that's great. But there's no one magic cure-all for everything. So the Dr. Gator smoothie is not a real smoothie. It really just kind of runs through the things that you should really be thinking about in terms of your health, like stress, environment, diet, toxins, community, love, bonding, all of those things. And that's the Dr. Gator, smoothie, again, air quotes, because there's no real one smoothie, but I'd want to have a little bit of a fun play at the beginning, with that. So that's kind of one part. The second part of the intro is talking about stress in parenting, because as a pediatrician, I've really found that parents are more stressed than ever. And I don't think they should be. I think it's an interesting world that we live in because we have so much information at our fingertips, and so that makes us more stressed out. We have social media, so we see how we think things should be, but the reality is that you know more than parents ever knew. We have more access to information than anybody ever had. It's the least, dangerous time in terms of like acute infections and things like that than it ever was. And so we really don't need to be as scared as we ever used to. And I went through like a couple of fun examples of like, they used to use like cocaine for kids, or mercury was in things, or radium was in products, and like just all these things that we used to have in our normal world that we know better now. And so it's like, yes, I mean, there are things to be stressed about, sure, but parents don't trust themselves. I feel like these days they're more concerned about every little thing than ever. And they're also more concerned about comparing themselves to other individuals. And I take care of, a lot of professionals, celebrities, dignitaries, things like that, just based on kind of where I am in Los Angeles. And, it's amazing to see, I'll see a patient come in and, you might know them from wherever, and I'll see them in the office and they're disheveled and, miserable and like complaining about this, that, and the other. And their kid had a really rough night and they were crying and, all the normal parenting stuff that happens in the first month. And then they go and you see their social media post and it's like, this beautiful room with everything perfect. Like, oh, I'm so blessed. Hashtag so blessed. Best time being a parent. And it's like, I just saw you 5 minutes ago and you were like basically in tears. Right. And that's not this to say that they shouldn't be that way. It's just to say that people don't necessarily post reality, but you're comparing yourself to that, which isn't reality.
Right. Yeah, and that's true whether it's parenting or fitness or health or money making or any of the things. Yeah,
Right.
social media is really the highlight reel for the most part. So, yeah, you have to take that with a grain of salt and realize that no one's life doesn't come with strife and stress and all the things. We all have it.
Mhm.
So,
Definitely.
I want to go back to the smoothie topic for a minute. And I know one of the biggest things I see a lot with parents is like over reliance on things like juice.
Hmm.
that, juice is loaded with vitamins and it's all these things. And I'd love to get your opinion on whether or not fruit juices or juices like these are really things that kids really should be getting their nutrition from, or if there's better avenues for kids.
Yeah, I don't think so. I would say no. I would say straight up no. I don't think we need juice almost at all. That's not something that kids ever used to drink before. It was water and milk. And now I don't know, our milk's not very good either, but that was what was ever, drank before. When you're getting juice, you're generally not getting a lot of nutrients at all. And you're just getting a ton of sugar, and especially the sugar in a liquid form, which is digested really quick, spikes your sugar really high, and mostly you're just getting sugar. So that's not to say that if you pick a fresh fruit and you juice it and you drink it right there, then that's a problem. That's not what people are doing, right? I think that's
Mm-mm.
probably okay in general, especially in moderation. But when you're buying the juices that are prepackaged from the store, then you're mostly just giving them sugar and chemicals and preservatives and very little nutrition. So I don't think kids should basically ever have juice. I don't think that there's a need for it. I mean, if you want to have it every once in a while, sure. But I wouldn't train your kids to drink juice, and I don't think they should be getting any nutrition from it. It's probably, for the most part, really crappy and not helpful in any way.
Yeah, I would agree. And I would say the same is true for adults. It's a blood sugar bomb. It's not serving you. It's not giving you nutrition. And if you look at the size of some of these juices, that would be the equivalent of eating like 8, 9, 10, 12, whatever pieces of that fruit. You
Mhm.
would never actually sit down and eat 12 apples
Mhm.
or, 5 oranges. You just wouldn't do that. And so you're getting sugar from that many pieces of fruit that you just don't really need, plus all the additives and things that they're putting in it. We had a brief interruption with some weather delays, but we are back for part two, and we're going to continue this fun conversation around, the healthy eating concepts, the mistakes people are making, how integrative medicine is different. So let's just dive right back in. We were talking about juice and the reasons why juice is maybe not so ideal because of the excessive sugar and just the concentrated nature of juicing. What are some other mistakes that people are making that they think they're doing the right thing, or they really just don't even know that it's a big mistake?
Yeah, so I mean, as you said, juice is I think a big one with sugar. I think sugar is a big issue, but then it's really the rest of the chemicals and the ingredients in there. So it really goes back to looking at the labels, seeing what is in everything that you put in your body and everything that you put in your family's body. And there's a very long list of chemicals, but I think the very basic, simple answer is look at the ingredients, and if you don't know what the word is and assume that it's probably not very good for you, especially if it's some long chemically name, then it's probably not ideal. So whether that's a food dye, artificial flavors, metha, tetrahexyl, whatever, right? Whatever they're putting in there as a preservative is probably not great for you. It doesn't mean it's like the end of the world if you eat it once, but these are all things that build up that are probably not very natural, if not natural at all, probably made in a lab somewhere. And so we just don't know what a lot of these chemicals do. A lot of them haven't been studied, but from the things that we have studied, for the most part, it's not very good for you. And we can see, with certain chemicals like, let's say, food dyes, that we know very well that they can cause, mental health concerns. They can cause attention issues. They've been linked to cancer. A lot of things in plastics have been linked to cancer. I mean, all sorts of products that are touching our food or that are in our food have been linked to a long list of issues, whether it's cancer, as I said, hormone issues, growth issues, development issues, mental health issues. So the more that we look into it, the more that we're realizing that these things can cause chronic health concerns, or at least are contributing to it. So ideally, look for real food, real ingredients, things that you actually know what they are, things that don't have a label, and that's going to get you a long distance. And you don't need to be a scientist or have a PhD to really do it. You just look at the label, or maybe it doesn't even have a label. And if you're eating those foods for the most part, you're probably going to be in much better shape than someone that's eating a bunch of boxes from the middle of the
Yeah.
food aisles in a grocery store.
Yeah. And so many of the foods that are touted to be healthy, they're in these packages or, cans or whatever, are actually fortified with nutrients. And
Mhm.
those aren't really even natural forms. Those are synthetic, they're added, they don't have the natural cofactors and all the other things that go along with it. So it might look like it has a lot of nutrition when you look at the label, but like you said, so many of those things aren't real.
Right, exactly. And I mean, we're up against big corporations and they're very smart and they're way ahead of the game. And so they know how to, quote unquote, air quotes, trick us into thinking that something's healthy where it's not very healthy. I mean, it's certainly important to read, right? I think if something is labeled as organic, that's probably better than it not being organic. I think those are all good things, but they are always one step ahead. Like, oh, it's BPA free, in the plastic, but then they have a BP whatever other thing, and maybe it's even worse. They know what they're doing. They're just responding to whatever we're forcing them to. And so, yes, it's better if these things are not in there. But just because something says, oh, it's so much healthier, it doesn't necessarily mean that it is. You have to become a little bit of a detective and look at the actual packaging, read the ingredients, and then see if it actually, seems like it is healthy for you, or at least healthier. And the easiest way to do it is just buy things that you actually know what it is.
Yeah, yeah, for sure. So, what about some of the things that are maybe not food related, but other lifestyle things? Where are people either missing the mark or just don't know some of the things that they're doing that are actually contributing directly to whether it be behavioral issues or growth issues or, whatever that looks like with their kids? And of course, all these same things are probably going to apply to the adults as well. What are some of the just other lifestyle things that people need to pay attention to?
Yeah, it's really the basic foundations of our health. So in the book, Parenting in Child Space, I use the mnemonic seeds, stress, environment and toxins, exercise, diet, and sleep. Every health, integrated practitioner has their own mnemonic, whatever you want to call it, but it's some sort of version of that, which is sort of just like the basics, including, community and love and coming together. And then, as I said, like stress, so decreasing our stress, making sure we're getting enough exercise, making sure we're eating healthy food like we mentioned, thinking about all the toxins that we're exposed to, and making sure that we're getting good sleep. So these are not rocket science things, these are basics, but we know that this is what affects our immune system. We know this is the building blocks of what keeps us healthy, and yet we're doing the opposite of all these things. We're getting worse at all these things. We're more stressed than ever. We're not sleeping as much. We're not getting outside as much. We're surrounded by more chemicals. We're eating crappier food. We're doing all the things that are against what we know to be healthy. And so it's no shock that we're having a chronic disease epidemic and we're sicker than ever.
Yeah. Yeah. I mean, we do not live at all like our distant ancestors did, or even our grandparents. Like it wasn't all that long ago that people still farmed and still canned their own food and, worked the land and walked and rode bikes and, did all these things more often. It really wasn't that long ago that things really shifted. So we
And I want to
definitely need
send
to get
that
back.
point because I think it's important because people always will comment back, well, couple hundred years ago, people died when they were 40, right? And that's also true, right? So that doesn't mean that we throw away all of modern medicine because there are some great parts of what we have discovered and what we've done over the last, couple hundred years. And so we don't die, nearly as commonly when we're 40 because we're much better at illnesses. We're much better at treating serious diseases. We have a great emergency department. We have MRIs and X-rays, and we have antibiotics and all these things that can save your life, which is great. But we've gone so far in treatment, but now we're living longer, but now we're developing these chronic diseases. And so it's somewhere in the middle. It's a balance. Doesn't mean we should throw away all of medicine, but we're getting to the point where life expectancy is going down again. And we're seeing an increase in basically every condition, whether it's autism, ADHD, allergies, asthma, heart disease, cancer, everything's going up, for the most part. And that's because of all these other things. So now, yes, we've gotten much better at treatments, but we also have to focus on prevention of these chronic diseases and also have to focus on how can we decrease those because we want people to not just live long, but also live healthy and avoid being on 7 medications. And most adults, I don't remember what the number is at this point, it's super high. It's like 70% or something like that are on multiple medications, if they're over 40 years old. So that's not what we're meant to be doing. We want you to live longer, but we also want you to live long and be healthy. And there are many places around the world, small blue zones where people live very frequently into their 80s, 90s, over 100, and they're very healthy and super active all the way, until 100 or later.
Yeah. It used to be that people mostly died young because of those infections. We didn't
Hmm.
have, wastewater systems and we didn't have all the antibiotics and we just didn't even know about, I mean, you go back far enough, they didn't even know basic hygiene principles. And so nobody ever washed their hands and people were, using the restroom, I guess, on the street. There was no plumbing. And
Right.
so yeah, a lot of people died from cholera and these, infections that we now can handle very easily. And so you don't die from those things anymore. So
Mhm.
I agree with you 100%. We need conventional medicine and we also need the lifestyle. I think we've become a little too reliant on medicine saving everything and we can just do whatever we want and just take the pill or take the shot or take the whatever and that fixes all things, but it really doesn't.
Mhm.
And now we're living longer, but we have way less quality of life
Mhm.
because we're losing physical function and mental function and just all of these capacities. And then you have all the side effects from the medications. So, yeah, I
Correct.
agree with you.
And that's what frustrates me so much about the medical system as a, I'm a regular pediatrician. I did all the regular training. I just got very frustrated with the regular system because it's very arrogant at this point. It's like, oh, this is the only way. This is the best way. Everything else is woo woo and it's out there. And that doesn't make any sense. Like, there's no reason that you can't mold the best of alternative medicine and other practices because all these things have been around for thousands of years and they have a lot of great wisdom. And also, medicine has been built up over the last decade, just like we said, for treatment. It's pharmaceutical, but that's not the whole picture. And there's this huge problem that has rose up over the last 50 years where we have all these chronic diseases, but medicine is in no way capable of handling that. It's not set up for it in any way. We're set up to give a pill. That's what there's time for when you have a doctor's visit, which is not how you're going to resolve chronic issues. You have to change the system, you have to change the basics, you have to change the foundations. And we need to spend more time and education on some of these factors because it's not that it's hard to change. It's really not technically, well, it's technically difficult to do. It's not actually physically difficult to do. It's just something we have to do as a huge change government wise, macro level changes, community changes, lifestyle changes. These are things that could be done. But obviously it's a lot. It's very complicated to change your whole community or change your life. But if we start to realize that, well, every other kid is going to have a chronic disease, maybe every kid's going to have a chronic disease. And at some point, people are going to say, well, that's enough. I guess maybe what we're doing isn't working. And maybe we need to make some of these bigger changes. I don't know. I
Yeah.
hope.
So, do you see that change? Obviously, this is kind of theoretical because we only can have our opinions of what the system should look like. But do you see that being where the actual system of medicine should change a little bit and the doctor should have more time with the patient and more training in nutrition and lifestyle and all of these things? Or do you actually see that they already have a lot on their plate and maybe we just need additional team members? We need nutritionists or dietitians or functional medicine practitioners or physical therapists and personal trainers. And, do you see this as being, we just need to incorporate more on the team rather than expecting your doctor to know all the things about all the things?
So that is what I think. That is what I talk about. I don't think it's realistic that we would think that a doctor is going to be able to spend an hour with every patient or more. And I'm not even sure that's the best use of their time. I think doctors have been trained in a certain way for treatment and for identifying disease, and I think that's extremely important. But I think that it needs a team because I liken it to the example of a dentist, right? You go to the dentist and you don't spend most of your time with the dentist. You spend time with the hygienist who works on cleaning your teeth and preventing cavities and going through information with you. And then the dentist waltzes in, the last second and they're like, boop, 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 with your teeth. Then they look at your x-ray and then they're like, this is all good, or they fill your cavity and then they're out of there. And I think that that's probably the better way to go about things in medicine. I think it's going to take a huge system change in terms of identifying that prevention matters because it has to be paid for by insurance and it has to be something that you set up. But it's absolutely possible that you could go to your doctor's office and before you ever see your doctor, you see two or three other practitioners and you spend half an hour on nutrition, you spend half an hour on exercise, you spend half an hour on whatever, and then you see your doctor with the write up and they can go through things or look at your ears or whatever it may be. I think that's totally reasonable, and it's going to become even more reasonable with AI, because as AI gets better, then you could spend time on some of those things with AI technology, kind of going through, asking questions, doing a write up. Maybe that puts out spits out something so you could actually speak to the nutritionist. They don't have to spend that much time, but the technology is starting to work towards where I think it would be possible to do something like that and spend more time on the specifics. I don't see that being very reasonable for doctors. You need a lot more doctors to spend
Yeah.
that much time, and the doctors aren't really trained in that anyways. Like you have to be humble. It's like a nutritionist knows a lot more about nutrition than me. An occupational therapist knows a lot more about movement than I do. So it doesn't make really a ton of sense for me to be the one giving an hour's worth of guidance on that. I talk about it and I know about it certainly, and I'm more interested in it. But I think doctors have a specified training. So if we can work in teams, which is the way it should be, then I feel like that would be for the benefit of everybody. But the system has to change. It will never happen if a nutritionist gets paid $7 to spend half an hour with somebody. Like that, it doesn't work. It has to be that you pay in this, enormous amount of money to insurance, and then you get some stuff back for it. You get your day at the doctor's office. You go there for a few hours, or the clinical center where you go in, once a year or twice a year, and you get all of these things.
Yeah. Yeah, I agree. I think that's one of the major complaints I see in my practice is people expect insurance to cover all of these things, and it
Mm-hmm.
doesn't often cover these. And the things that it does cover don't really help all that much. That you still have a lot of answers. You get standard information, you get basic things, and you get the same dogma, unfortunately, because that's what insurance agrees with. And so I do think we're ripe for the whole system to be, changed and altered and improved and give a better patient outcome, a better patient experience, a better doctor experience. Frankly, I can imagine how frustrating that is as a doctor, even to
Mm-hmm.
be pummeled with questions that you're like, I don't have any training in that. And I'm expected to know all these things. And so,
Or you do, but you don't have enough time. Like
yeah,
how are most doctors are great people, right? Like pediatricians, they're good people. They went in to help kids, but you can't spend an hour and a half with each patient, or your business is going to close. It's like it's both things, right? You have to help people, but you also have to be practical. And the system, if it pays you $50 or whatever to see a patient, you're not going to get very far if you see one or two patients in an hour. You're going to close.
right.
Like your costs are more than that.
Yeah,
So it will take an overhaul, and it's not going to happen with the insurance model, as it is, unless it's forced to do something else, because it will require them to invest in the short term for the long term, and companies don't like to do that because they only care about this quarter, right? And so it would save money in the long run. It would. I mean, people would be healthier,
yep,
but you'd have to invest a lot of money to pay the practitioners to do these things, to have people to go, and that's a long-term investment. And our capitalist type system isn't really set up for that. So healthcare is going to have to be taken outside of that system to some degree
yep.
to have it be successful in that kind of way that you're mentioning.
Yeah. And I do think there's a little bit of a trend in that, unfortunately, for those who have money only,
Right.
who can pay cash for these extra services. But I also see it a little bit in some of the self-insured companies because they
Mhm.
do have a vested interest in
Mhm.
lowering their costs. And so I think there could be a grassroots effort that kind of happens behind the scenes that forces this when all of these self-insured companies and all of these people who do have money kind of start to show how different it can be. The
Mhm.
results that they're getting are so much better than the standard of care that you get in just the conventional insurance-based model. I do think, that's going to show a lot,
It's
but it's a
slow.
slow moving ship.
Right, exactly. It's slow, but it is possible because I mean, let's say just like America, for example, like America's going to go bankrupt if the progression of health goes in the way that it's going. I mean, it's not going to be that long. Predictions are 20, 30 years. You're going to run out of money, right? And not even maybe that long because
Yeah.
if we have more and more chronic disease and more people need medications, and as you go on, that these things need to be covered, and for some things that they are covered, especially if you're in the lower income classes, eventually it's just going to be too much money. Like it
Yeah.
will never happen. So there has to be some push at some point to be like, well, this is so bad. Like we have to do something or we won't be able to do anything for anybody. So
Yeah.
hopefully, it's bad enough or it's getting bad enough. I mean, it's not a good thing, but sometimes it just takes it being that bad for it to make a change. And at some point, it's going to be bad enough that these companies or the government or whatever are going to be like, well, we better do something about this. We better put some money into prevention because, we're not going to have a system, fairly soon if we don't. And that's where we're headed. I mean, it's no question about it. Everybody's sick. Everybody's obese. Everybody has diabetes. Everybody has some sort of chronic condition and multiple medications. And that's not affordable in the long run.
No, and it's getting younger and younger and younger. I mean, when I was a kid, kids didn't have these illnesses. We didn't
Mhm.
have overweight classmates. We didn't have kids on a boatload of medications. And
Right. It was very rare. I don't
now
remember
that's
anybody with,
common.
with peanut allergies or eggs. I'm sure there were, like I'm sure there were some,
Yeah.
but it's like everybody has it now
Yeah.
versus, maybe the odd person
Yeah.
here or there had it, or maybe, somebody had some sort of condition versus 10% have this and 10% have that and 50% have this. And like the numbers are huge.
Yeah. Yeah, it's crazy and really sad, and it's going to exponentially get more expensive because of that.
Hmm.
If you're starting these diseases at such a young age, they're going to progress so much faster and cause so many more problems than we've seen in previous generations. So it is a serious problem. And I think this is where that personal accountability really has to come in. We each have to start taking our own responsibility for our own health. We have to stop giving all of the power just to the insurance model and our doctors. We have to start making better choices. We have to start living different lives. No one gets to decide that for you.
Hmm.
You have to decide for yourself. And so I think the more we can educate people on mistakes they're making, things they can actually do, things that they can change, maybe we can reverse some of this even outside of the medical system.
I agree. And that's why even like my first chapter, the intro chapter in the book, it's about health. It's about wellness. It's about the seeds of health. It's about the smoothie. It's about all those things because most parenting books, they just get into tantrums and, potty training and this and that. But all that stuff is important, but none of it matters if you don't have your health. And it comes back to that as the foundation. And so that's why for me, I have a unique position because I'm a pediatrician and I have a little, health background and a little bit more than some of the, therapists or the other people that write parenting books. But it's important. I mean, it's the foundation of our health and everything else. And we need to focus on that too. And I don't think it's happening enough. And so that's one of the big pushes for me to even write the book in the first place, right? Was just to bring parents on both sides, like talk about the common things that you're going to ask, but also focus on how do we be actually healthy.
Yeah, yeah. I love that. And I think that's a fantastic way to wrap this up. Will you just give everyone a quick overview again of when the book comes out, what's all in it, how to get it, all the things, and we will make sure everyone gets that.
Sure. So you can follow me on Instagram is probably the main place, Dr. Joel Gator, and lots of free, free stuff there. I'm always chatting and doing Q&As and all sorts of fun stuff. So if you have questions, you can always reach out to me there. The book is called Parenting at Your Child's Pace, Integrative Pediatrician's Guide to the First 3 Years. So you can grab that, wherever, Amazon, Barnes and Noble, all the places where you get books. So that's probably the easiest place to find. And you can go, the website is parentingatyourchildspace.com. So if you want to look at the book a little bit more, get some freebie stuff, then you can go there. If you pre-order, it comes out in August, but you can pre-order anytime and then have a bonus chapter that you can get the first chapter. I'll send you some freebies. So if anybody wants to do that, then just email me from the website and I'll send you that stuff.
Love it. Love it. It's so exciting. I think this is going to be a fantastic book. I wish you all the best in the book launch. And thank you for sharing all of your information about, especially health for kids, but also all of the same things apply to adults, and all of us can just live better lives with this information. Thank you so much.
Thanks for having me on.
Absolutely. And to everyone out there, be well and vibrant, and we'll catch you again on future episodes.